Mobility is a huge aspect of quality of life for our patients. We see owners make end-of-life decisions even with mobility issues. So addressing mobility in our field is extremely important. We have clients that come to us with animals that have multiple joints that have evidence of osteoarthritis for various reasons. And so being able to offer them different modalities is extremely important. In a clinical case that we had in which we had multiple joints affected is specifically a dachshund who came into our practice with both knee issues and elbow issues. We were able to come up with surgical options for the knees. However, the options for the elbows were much more limited. Under the same anesthetic, we were able to adjust both of the knees. However, we wanted to offer something for the elbows. In that case specifically, we used Arthramid in order to help with some of the inflammation in the elbows. And we were able to inject it into the same anesthetic event. And so it didn't require any extra time. It was very seamless. And the owners following that surgery and the injections was extremely satisfied. They found that it resulted in a much better mobility for their pet, not only in their hind limbs, but the forelimbs. And so they were very thrilled with the response to both the Arthramid in conjunction with the surgeries. And so being able to adjust multiple joint disease is extremely important because it's usually multiple joints that we're dealing with. And while there's surgical options for some, we're much more limited in what we have in terms of modalities and what's in our toolbox for other joints, such as the elbow, which is fairly unforgiving. So I think it's a great modality to consider, especially given all the evidence-based medicine that's coming out. And then owners love to have the opportunity to, offer that for their pet and see that response is just really fulfilling, I think, as a practitioner.